Hello, I'm Dr. Parsa Mohebi from Los Angeles, offices of Parsa Mohebi Hair Restoration. I want to tell you everything you need to know about celebrity hair transplant. What is a celebrity hair transplant? A celebrity hair transplant is when we do a hair transplant by excising the hair, the grafts from the donor area without shaving it, without any shaving in the recipient area, and with using minimal touch to the grafts, removing them and placing them with Mohebi inserter. We also use simultaneous extraction and placement, meaning that we make the size first, remove the grafts, and place them as soon as possible so the graft stay out for a minimum amount of time. So celebrity hair transplant, how it got created and how it's evolved over time. Speaking of celebrity non-shaving FUE, I see that I didn't shave. I noticed I haven't shaved today, but that goes well with this video that we're recording today. Anyways, so celebrity hair transplant started many years ago when we were starting to do FUE hair transplant. FUE hair transplant is, or follicular unit excision, is when we remove hair one at a time from the donor area. That requires shaving, usually requires shaving, because in order to see those grafts on the microscope and remove them, we have to be able to cut them to number 0 or clip them with number 0, so microscopically we can see the grafts, go after them and remove them. So it was almost impossible to remove them without shaving head. But in our Los Angeles offices, we have a lot of celebrities, a lot of people who are in front of the camera. They just cannot afford to shave head. So we started with layer shaving, with having them grow their hair long, that allow us to just do layer shaving and go in between those layers and remove hair. But even layer shaving was not good for everyone, but because not everyone could grow the hair long enough for us to take advantage of layer shaving. So we started doing a small areas, like a small circles of shaving, and remove hair from those areas, another small circle. So it was okay, but it was still like kind of patchy after the hair transplant. Eventually we realized that the best way to avoid this appearance of shaving and get to the grafts that we want is to cut one hair at a time and remove it, cut another hair and remove it. That's how we started doing celebrity FUE. Back then, we were just starting this, our technique and our tools were not as sophisticated as today, so we were not as efficient as today. So the biggest procedure we could have done was 500 grafts per day. So patients had to come, we have to cut one hair at a time and remove it, and the technician should remove it, and then we have to make size and place the graft. So over time, we got more efficient by doing all the cutting the day before procedure and bringing the patient in, and then remove all those grafts the day of procedure and place them. So it was like a day and a half for still like up to like 1,000 grafts or maybe 1,500 grafts. And then we got even better with the new technology that we have with Trivellini LongHair punch that is available to us. We can go and remove hair, even long hair sometimes, and we don't have to pre-cut them before the procedure. So patient come the day of procedure, we can go up to 1,500 grafts per day with this new methods of celebrity hair transplant. So who is a good candidate for celebrity hair transplant? Celebrity hair transplant is good for people who cannot shave head. There's no way they can shave head. That's the only way they can do it with celebrity hair transplant. For people who visibility after procedure is important to them, so they want to have complete undetectability after hair transplant. And obviously this procedure is more expensive because it's more time consuming, so affordability is another issue. So looking at the whole thing, people who are trying to avoid visibility after procedure, no shaving in recipient or donor area, and they can afford the procedure. How is a celebrity hair transplant done? Celebrity hair transplant is similar to regular FUE transplant in many aspects. So patients come to their procedure, we design the hairline, and then we take them to the procedure room, we give them local sedation and then local anesthesia. So we usually use laughing gas and Valium to keep them relaxed throughout the day, and then we start with local anesthesia. People may feel a little bit of a pinching in front and back of the head, and then after that everything is numb. So there's no sensation when we're making sites or when we're extracting or placing the grafts. After the local anesthesia, the next step is that we make sites. I want to make all the sites beforehand. The reason for that is because when the grafts are coming out, we can place them right away. We don't want to wait for that. We don't want to have this live tissue staying out of the body for a long time. So we call it pre-made sites because we made them at the beginning of the procedure before we do anything else. So design takes me probably a good hour or so at the beginning of the day. That's when I decide on the angle, distribution, even curvature of the hair. And I have to take my time because we don't shave head, so we have to go between existing hair at times and make sites. After site making is done, the next step is that we change patient's position and start extracting the grafts under microscope. I use microscopic loops and start removing the grafts. And while I'm removing the grafts, another team of technicians are ready to place them. So basically, I excise the grafts. A technician removes the grafts that I excised, hand them to the counting and sorting team. Under microscope, they count them and sort them and deliver them to the placing technicians. Placing technicians are ready with Mohebi inserter, another invention of mine that allows them to load the grafts into the inserter and put them into the sites and push the plunger, release the graft and pull the inserter out. So this whole process is going to be very harmonious, and there's no interruption between the time that we remove the grafts to the time that we place them. So what is simultaneous placing? That's one of the key elements in celebrity hair transplant, is when we place the grafts as we are extracting them. So it requires a few different components. One is a chasing method. So basically I start extracting from one side of the head and keep going to the other side. So basically patient's head is usually facing one side and I'm behind patient. I start extracting from this side, patients go face down, I extract from the back and patient goes to the other side and I extract from the other side of the head. While I'm extracting, a technician follows me and removes the grafts as fast as they can, so the grafts will be out and be ready to be evaluated under microscope. That's called chasing method. So what are the advantages and disadvantages of celebrity hair transplant? Celebrity hair transplant obviously does not require any shaving. So no shaving in the recipient area, no shaving in the donor area. Patients come in and go out usually with no detectability whatsoever. Of course, when we do the hairline, if the hairline is completely gone and we're restoring the hairline, there's no way they can hide it. They can wear a hat, they can wear a bandana, but in most cases that people are having still long hair, we don't shave them, people can easily hide it. In fact, the day after procedure, when they come back for hair wash, we usually bring patients for hair wash. They can even get a basically blow dry before they go home, and that makes them look perfect. The other advantage of celebrity hair transplant is the minimum basically downtime. People can go back to work immediately the day after procedure. There's no visibility really. There might be some swelling on the forehead when we do the hairline, and for that we give patients medications, usually prednisone, which is a steroid, for the first few days to minimize the swelling. But other than that, there's not much visibility. The disadvantages of celebrity FUE are that most of the cases of celebrity FUE are limited to 1,500 grafts. With current technology, we are pretty efficient compared to what was done before, but we try to keep it at 1,500. Sometimes we push to 1,800, but we don't want to go for more than 8 or 10 hours because that will be longer on the team and is probably not as efficient. So if people want to have more than 1,500 grafts, sometimes we do even 3,000, a little bit more than 3,000 in 2 days. We can arrange them to be done in 2 days. So each day we schedule for 1,500 grafts. The other disadvantage of celebrity FUE is because it's more time consuming and more labor intense, the charge is a little bit higher than regular FUE. Let's answer some of your questions that are coming to us. The first question is, how is the survival of the grafts? So the survival of the grafts between celebrity hair transplant and regular FUE are pretty much similar. So the grafts that are removed, we have a different technique of removing of the grafts, but the quality grafts are more or less the same. When they are being harvested and examined under microscope, we see pretty much the same quality grafts, and only intact, perfectly looking grafts are being transplanted. At times we have transection, which is when out of a group of 3 hair roots, maybe one of them will be missing or transected. That could happen occasionally, usually less than 5 or definitely less than 10% of the grafts we see this, but most of the grafts are intact and have all follicles intact. Is celebrity hair transplant available to women too? The answer is yes. Although a lot of women who have longer hair, they can easily get by with regular FUE through layer shaving. So we just shave one area of the back between these two areas, between ear to ear on the back, and long hair, if you have long enough hair, they can cover the shaved area. So if that's not an option, if you're a woman who want to keep the hair much shorter and layer shaving doesn't work does not work for you, we have to do this again. So the next question is this procedure, celebrity hair transplant, available to women too? The answer is yes. Women, men, they both can do celebrity hair transplant, although women with long hair, they can easily get by with regular FUE with just layer shaving, so they don't have to get celebrity FUE and spend more money and less number of grafts probably by not shaving at all. A lot of women who come to our office are very comfortable with layer shaving, although if you're a woman with very short haircut and you want to keep that style, or you don't want to have any shaving regardless of whether or not it's visible, you can still do celebrity FUE. Next question is about a haircut before celebrity hair transplant. So before celebrity hair transplant, we don't want to have, obviously we can do it at any length pretty much with celebrity hair transplant. The ideal length is something like a few centimeters, with number like 4, 5 or more. If it's too short, it might be a little bit more challenging to do celebrity hair transplant, which I don't think it's even needed to do celebrity hair transplant. If you always do faded on the back, regular FUE cuts it with number 0, which in a couple days it becomes like number 1 or 2. Very long hair for celebrity hair transplant, like people who have like shoulder length or even longer hair, it makes it a little bit more time consuming to do the celebrity hair transplant. But it's not impossible, and we can still do it at any length of hair. The next question is cost of celebrity hair transplant. The cost of celebrity hair transplant is more than regular hair transplant. For example, if the cost of regular hair transplant is $8 per graft, the cost of celebrity hair transplant is $14 per graft. The cost is the same in different offices we have: San Francisco, Los Angeles, Beverly Hills, pretty much the same cost. The next question is, where could it be done? Currently, Parsa Mohebi Hair Restoration is the only center who is able to do celebrity hair transplant. This is a very exclusive procedure to our offices. We offer it in our offices in Los Angeles and San Francisco. So both Southern California patients and Northern California patients can get celebrity hair transplant done in one of our offices. If you're living in other cities, you can travel to California and get it done in one of our offices. Even we have patients from other countries who travel to the United States to get their celebrity hair transplant done through one of our offices. The last question is, when can I return to work? That pretty much has to do with where we're doing the transplant, the transplantation area or recipient area. If it's right at the hairline, if the hairline is completely gone and now we're recreating it, obviously the area that's transplanted for a couple of days, you're going to have some redness, some swelling. We're not shaving anything, but it's going to be visible. If your hair, transplant hair is behind the existing hairline or in the crown area, on top area, it's easy. Nobody will see it even the day of procedure when you're leaving the office, because bandage. We don't even put bandage for celebrity hair transplant usually. We don't have to. So people walk out with long hair, with regular hairstyle, and there's no detectability. There might be some swelling after procedure on the forehead. We give you medication for that, but going back to work could be done the day after procedure. So you're functional. You can do pretty much anything, and worst come to worst, you have to deal with some swelling or some redness or pinkish discoloration on the recipient area for a while. Well, thank you guys for tuning in. That was a good opportunity for us to answer some of your questions and go over the topic of celebrity hair transplant from A to Z. I encourage you to continue asking questions in the comment section in our video. Make sure to go back and check them often. and provide your answers. If you have more questions to ask, or if you want to come to one of our offices and meet one of our physicians, we'll be happy to see you and review your questions or concerns, and hopefully plan for a hair transplant in one of our offices in California.